I'd like to introduce today our friend, Diana Lyles. All right, welcome, Kate. Welcome, everybody. Let's get started, okay? It was maybe Ivan that requested a pharmacology lesson. Was it Ivan Lutsk?
Yeah, it was me.
Great. Well, thank you for the request, because it was because of your request that we're here today. Because I'm currently in America and I had the privilege of a volunteer pharmacist who has some time at 11 o'clock in the morning here, we're honored to be able to do this lesson together. Here's what we're going to do today. We've kind of done introductions. We're going to work on pronunciation first. We're going to let you hear her voice along with mine. And then I want to cover some important English verbs in this world of pharmacology and pharmacy. Then we'll work with some questions, giving you a chance to talk to us about the differences in our systems. And I think that will be very fruitful. And then I have a final translation exercise at the end to challenge you and your English. So let's get started. Does anyone have suggestions of how we might classify the whole world of pharmacology? Talk with me in English or in your native languages. How can we categorize this world, this ocean of medications? How might we do this?
Maybe approved and unapproved.
All right, that's a great start. Who might
prescription
approve
and over-the-counter?
not approved medications, Yvonne?
In the United States, maybe FDA.
Governments, such as the Food and Drug Administration. All right, that's one category. Anastasia, I think I heard you.
Yes, I was mentioning prescription drugs and over-the-counter medicines.
Excellent. Now, even within drugs controlled by prescriptions and those that are over the counter, we have other categories such as chemical class, pharmaceutical classification. We have drug actions. We're going to talk about the different ways you can classify today. It's a world of information, far more than we can cover today. Diana, tell us what an over-the-counter medicine is in your best English. What do we mean? What do we mean by over-the-counter medicine?
It is a drug available for purchase without a prescription.
Повтори, пожалуйста, на украинском. Кого-то?
Доступ медицинских препаратов на рынке.
Вадим, пожалуйста.
Ліки доступні без рецепту.
Okay, that's it. The
OTC.
patient can walk into a pharmacy and buy the medicine without a doctor.
OTC, we call it in Ukraine.
Еще раз.
Recept. In Ukraine and farm business, it's called OTC. OTC, рецептурная группа препаратов, и OTC call it. OTC,
Okay. Here's an ethical question for you. Should antibiotics be over the counter?
No, of course.
So Khadija says no, of course. Vadim, what do you think? Should prescriptions for, should antibiotics be over-the-counter medicines?
Okay.
Yes, in our country, patient can buy antibiotics without prescription. It's a pity for us.
But it is not legal even. It could be persecuted by the Ukrainian law. I know it exactly.
Well, this American has done it dozens of times.
And it is how by the law in Ukraine, it's not legal, but it's happening because our corruption.
So Diana is now hearing the world of Ukrainian medicine. This is classic. So this is one of the things that we're going to discuss in today's lesson. So let's begin. So pronunciation. Произношение, пожалуйста. We can talk about химический класс, chemical class. We can talk about mechanism of action. We're going to go back through these all in just a moment. We can talk about mode of action. such as a positive inotrope or a diuretic. That's different than mechanism of action, which is more of a chemical idea. And then we can talk about therapeutic class. So it gets very complicated quickly, yes? Okay, произношение, пожалуйста, после нас. Окей, после меня, пожалуйста. Beta-lactam antibiotic.
Beta-lactam antibiotic.
Antibiotic.
Benzodiazepine.
Benzodiazepine.
Cardiac glycoside.
Cardiac glycoside.
Glycoside. Glycoside.
Еще раз. Cardiac glycoside.
Cardiac
Cardiac
glycoside.
glycoside.
Fibrate.
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 Thiazide diuretic.
Thiazide diuretic.
Diuretic.
Steroid.
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 Triptan.
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 Let's move forward. Произношение, пожалуйста. Diana, please read and let them follow your voice, okay?
Okay.
So say the word and then let them hear your pronunciation and let them repeat after you.
5-alpha reductase inhibitor.
5-alpha inhibitor.
Reductase inhibitor.
Very good. Angiotensin 2 receptor antagonist.
Angiotensin 2 receptor antagonist.
Antagonist.
ACE inhibitor.
ACE inhibitor.
Okay, let me stop us. Who would tell us what ACE stands for? What's this abbreviation?
Angiotensin converted factor inhibitor.
Mm-hmm. And angiotensin
Angiotensin.
converting enzyme
Enzyme.
inhibitor, right? Okay, дальше, пожалуйста. Further.
Alpha adrenergic agonist.
Alpha adrenergic
agonist.
agonist.
Beta blocker.
Beta
blocker.
Not beta, beta.
Beta.
Beta blocker.
Okay. Dopamine agonist.
Dopamine agonist.
Agonist.
Dopamine antagonist.
Dopamine antagonist.
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 All right, let me stop and ask, please, someone who has not yet spoken, tell us the difference in English between an agonist and antagonist. Try to put it into English words.
They have the opposite mechanism of action.
Excellent. What does an agonist do versus an antagonist?
Agonist stimulates something, and antagonist stops or reducing or doing opposite.
Let me write these words. You're giving us good material. Stops, reduces, blocks, down, regulate. Those are excellent ideas. In the pharmacology world, an antagonist is a blocker. So a beta antagonist is the same thing as a beta blocker. Okay. All right. После меня, пожалуйста. Incretin mimetic.
Incretin mimetic.
What is a mimicker or a mimetic? What does that do?
Look like.
Yes, if we mimic each other, then whatever facial expression Diana makes, I would mimic her, or I would do this. Some birds follow other birds and sing the same songs. They mimic the songs. So some drugs that are chemically manufactured in a pharmaceutical company can mimic or be like naturally occurring medications that God has placed in our bodies to work in certain ways. Now, everybody knows NSAIDs, После меня, пожалуйста, non-steroidal anti-inflammatory drug. После меня, пожалуйста, non-steroidal anti-inflammatory drug.
Non-steroidal
Non-steroidal
anti-inflammatory drug.
inflammatory drug.
Okay. Also known as cyclooxygenase inhibitors.
Cyclooxygenase
inhibitor.
All right. Let's move forward a little faster. Diana, please.
Oh,
The
see
grader.
them. Okay.
Mhm.
Selective glucocorticoid receptor modulator.
Selective glucocorticoid receptor modulator.
Modulator.
Okay. What does it mean to modulate? What does that idea of modulate mean?
Stabilization.
So there's a verb here, to modulate. It's like Двигун in the automobile, the engine. We modulate the function of the engine by pushing on the accelerator pedal, giving it more gasoline or benzene and oxygen makes the engine run more. And when we reduce the pressure on the accelerator pedal, it slows the engine down. So that's to modulate, means to change. So this word modulate means to change. После, пожалуйста. To modulate.
To modulate.
Receptor modulator.
Receptor modulator.
Okay. All right. We'll do this another couple of minutes and then we're going to move forward. Let's change now to mode of action. Okay. Diana, please read this list for us. Just read the whole list. Read from the beginning to the end of the list.
Okay. Diuretic or antidiuretic, inotrope, chronotrope, bronchodilator, decongestant, antithrombotics, antifungals, antimicrobials.
All right. Halia, it's great to see your face today. Thank you for joining us. Ask me a question, please, about one of these classes of drugs based on mode of action. Simply create a question in English for me about something on the screen here. Anything you'd like to know.
What is the difference between diuretic and bronchodilatator?
All right. Great question. Diuretics work on the kidney system, the excretion system of the body. They cause an increase in urine output. Bronchodilators work on the lungs and particularly the smooth muscle of the airways of the respiratory system. They cause an increase in diameter of the airways, which allows better airflow. So they're entirely different systems, organ systems, and different kinds of action. Great question. Would anyone else like to ask Diana a question about this screen?
Do you use antithrombotics in case of COVID-19?
Okay.
That is not something that I have seen used here. For the most part, there's been antibiotics and pain relievers for any fever or pain, and steroids, but not any antithrombotics here.
Excellent question, Vadim. I think we've seen a lot of use of antithrombotics in Ukraine. And I believe that as physicians, looking at this from my standpoint, I think we should be doing this in people who have high risk of thrombosis. But probably not everyone needs Xarelto or other expensive oral antithrombotics. Diana, have you ever heard of the drug called Xarelto?
Yes.
What is Xarelto?
It is an antithrombotic, but I have seen that for cardiac patients that need it to help with prevention of clotting because they have a history of stroke.
Interesting. Is Xarelto used in Ukraine after hip surgery to prevent post and peri-surgical thrombosis?
Yes, they do use that as well as prophylaxis for deep vein thrombosis.
Okay. Now, is Xarelto a low molecular weight heparin?
It is not. The exact term escapes me, but it works more on the factor 10A pathway.
Wow, she's smart.
Rivaroxaban, that's Xarelto.
Yes. So enoxaparin, после меня, пожалуйста, enoxaparin.
Enoxaparin.
So listen to the English language, parin. So it's a very different pronunciation of that class of drugs. All right, this is great. Let's keep going. Therapeutic class. Быстро, пожалуйста, после меня. Analgesics.
Analgesics.
Antibiotic.
Antibiotic.
Anticoagulant.
Anticoagulant.
Antidepressant.
Antidepressant.
Anti-cancer.
Anti-cancer.
Anti-epileptic.
Anti-epileptic.
Еще раз. Anti-epileptic. Epileptic.
Epileptic.
Antipsychotic.
Antipsychotic.
Antiviral.
Antiviral.
Okay. Enough of that. Now, let's change. I would like for you to read these. I would like different people. Let me stop sharing. We've got 27 people with us today, which is fabulous. I'm going to prescribe.
To prescribe a course of treatment, a medication, an ointment.
All right.
I don't see the last words.
Let's see if,
A suppositorium, yes?
uh-huh. So, suppository.
Suppository.
Yeah. Taisia, how would you translate suppository?
Suppository або свіча.
Svicha. So the word is that sort of like a candle or wax idea?
Yeah.
Yes,
It's a candle idea.
Yeah. So, okay, this is Diana's world. So what does it mean to prescribe? Do you prescribe medication?
I do not.
Oh, she does not prescribe. Who prescribes in America?
So the physician will prescribe the medication and the pharmacist would fill the order.
Uh-huh. So thank you, Taisia. Who would like to read our next one?
May I?
Please.
So to write, for example, a prescription.
Right. Yvonne, do you write prescriptions?
Not yet.
Uh-huh. All right. When you do, when the day comes that you're a practicing physician and you will be writing prescriptions, notice I am speaking and I'm giving you the future or the present continuous verb tense. When you will be writing prescriptions, see how we use that verb tense commonly in speaking English. How will you do it? Will you prescribe by paper or by electronic transfer from a computer?
It looks like then when I will be practicing medicine in Ukraine, it probably will be only electronic.
Mm-hmm. So electronic prescriptions have come to Ukraine. What is the situation in the United States, Diana?
It is a combination of either a written prescription or electronic. There is the requirement for controlled substances for pain, that such as opioids, that they are required to be electronic now.
So opioids or controlled drugs, narcotics, fentanyl, for example, all these in the United States must come to you by electronic?
That's correct.
That's interesting.
Yeah,
Because-
including, and also include some ADHD medications like Adderall.
So what is ADHD, my colleagues?
Attention deficit hyperactivity disorders.
Yes, attention deficit hyperactivity syndrome, right?
Yep.
Yeah, it sounds like most of my children. I don't know about yours, right? So what is a drug or a medication that might be prescribed for attention deficit hyperactivity syndrome in America?
Methylphenidate.
Еще раз?
Methylphenidate.
Methylphenidate.
Atomoxetine. Atomoxetine.
Yes. These are stimulants, right?
Yes.
Now, why would somebody with hyperactivity need a stimulant? But it's always been fascinating to me that the drugs like methylphenidate, Ritalin, other stimulants down regulate or suppress the hyperactivity of children. So it's a paradoxical effect. Paradox means the opposite that you would expect, right?
Because they don't have, it's like electricity, Jeffrey, like in the synapse, not pathway, and this reacted with agitation and not concentrated attention. And then proper going impulses between synapses, patient more stable. It's something,
Okay.
I think it's something like this.
I think it's something like that too. Khadija, please read the next one for us. The one that's gray here on the screen.
To dispense 30 tablets according to the doctor's order.
All right. So Khadija, you're in London, am I right?
No, in Andover, but it's not far from London.
All right, United Kingdom. Do you
Yeah.
dispense medicine there?
No, yet.
Not
No,
yet.
I'm not. I probably never will be even dispensed, because if I will work as a doctor, I can't dispense. It will be do pharmacies.
Right. So what does dispense mean, Khadija?
If I understand which is in this coma, in the coma, it's mean will be preparing medication which patient will be taken.
That's right. And it means
Preparing order what doctor prescribed.
to prepare and to give out, to give over to the patient. Right? So the idea is that we prepare and then we hand it over, usually for money.
Yes.
Right? Now, are medicines free in America? Diana, can you dispense any free medication?
I cannot in the job that I am in, but there are some pharmacies that do receive funding from the government that will supply medication to some patients.
So it's free to the patient, but the government is paying the pharmacy, right?
Yes.
All right. So it is clear that doctors prescribe medications. They prescribe treatments. They prescribe therapy. And I could put that up here. The word therapeuta obviously confuses me as an American doctor. Я терапевт в Украине, да? But therapy means a different sort of thing in America. It means manual manipulation of a muscle, or it means a mode of treatment that is not about medications usually. So it's a very different concept across our cultures and words. But a pharmacist like Diana dispenses medications according to the prescription. All right, Dalsha, who wants to say this one?
To take a medication by mouth.
Okay, excellent. Is that Yaroslav?
I'm Kirill.
Kirill, good to have you. I didn't know who was speaking. Kirill, please give us a complete sentence as if you were telling a patient what to do, using the verb to take. And I will type what you say. Choose a course of treatment, choose a medication, and then here's what you say to the patient. Give us a good sentence in English, please. Her name will be Mrs. Jones.
You should take this medication twice a day orally.
All right, that's great. So what does it mean orally?
By mouth.
Right. What is the abbreviation on the prescription that Diana would see? Do you remember we talked about that in Latin? It's PO. Do you know what that stands for in Latin?
Per os.
Per os, exactly. You remember I did a whole lesson about prescriptions Sunday evening, okay? So Vadim, what does it mean to apply something? To apply. Это заява. Я хочу работу, да? Can't hear you. Turn your microphone on.
Ні, я не знаю, що сказати.
Aha. Interesting. To apply for a job is a common construction. When you became a pharmacist, where did you first apply for a job?
I applied at Walmart pharmacy.
Okay, we have a famous торговый центр в Америке, называется Walmart. Okay, and in Walmart you can buy anything. You can plant your garden with tools and seeds. You can buy food to eat. You can buy dresses, ladies, or shirts, men, underwear, socks, and you can buy a boat or a fishing rod if you like. And there's a pharmacy inside. She works at the pharmacy inside Walmart. So she applied for a job, but that's not the meaning of this. Yes, she says she even applied for pharmacy school, just like I applied to medical school. Those are different meanings. Here, to apply an ointment to the skin, что это, Vadim?
Ну, тільки українською можу сказати, наносити.
Да, нормально.
Да, хай мені колеги допоможуть, я щось синоніми забув.
Put something on something.
To put on just.
Use.
Yes. Дякую.
Put on a screen.
Намазать.
Да.
Use to use.
Мазь. От слова мазь.
Use it.
Мазать.
Мазать, да, размазывать, да, smear, to put all over the skin an ointment. Что такое ointment? There's no
Maz.
Maz. Ointment is maz. Dalsha, who will read the next one?
May I?
Please.
To put a bandage on the skin, a bandage over the wound.
Excellent. That's Rashid, yes?
Yeah.
I'm really glad you joined us today. Rashid is a vascular surgeon at Shupik and a friend. Now,
Yeah, in Shalimov Institute.
Shalimov
Vascular
Institute.
Surgery and transplantology.
So transplantology, he's doing high-level work as a surgeon in Ukraine. Thank you for joining us today. Do you put bandages on wounds, Rashid?
Of course.
Of course, interesting. It's not so in America. The nurses do that in America.
After varicosis surgery, to like bandage, to compressor the wound, to compressor the to avoid maybe to avoid the infiltration or bleeding.
Exactly. So a compress is a pressure bandage to the skin. Now look at these. One reason I'm doing this is I want you to notice the prepositions. We put a bandage on the skin. Let me see if I can get this. We put a bandage over the wound. We put a suppository into the vagina. We talk about side effects of a medication. Notice that what I'm doing to you is making you think about the way we use the prepositions in English with this section. All right, we're running out of time, so I want to give some time for you to ask questions to us. But are there any other of these verbs that you have questions about? To apply, to put, to insert, to refill, to warn, or to phone?
I would say that I have a question about refilling the prescription.
Good.
I wonder how it's done. I mean, is there a prescription and it says like the amount of pills or something and the amount of times when a patient can refill, I don't know,
Vitaly,
bottle?
good to hear your voice. You brought up exactly the question that I would hope. Let me see if I can let Diana answer your question. What does it mean to refill a prescription? And Diana, what does it mean to refill a prescription? To refill.
To refill is to fill in order that you have already filled before. It's very common to be seen with blood pressure medications. So if it's something that the patient will be taking continuously, the physician can order refills so that way the patient can continue to receive the medication without having to come back for another office visit.
Excellent. Now this looks like a prescription to me.
Mhm.
Yeah.
Yes.
Can you read most of the handwritten prescriptions that doctors send to you?
With a lot of practice, I can read most of it now. That is the wonderful thing about electronic prescriptions, because I do not have to worry about messy handwriting.
All right. Does this prescription allow refills?
No, this one does not.
No, it does not. How do we know that?
They will usually indicate a 0 for refills, or if they do not mark it on the prescription, we will assume the refill is 0.
Okay, so if you do not write anything, she assumes, Vitaly, that there are no refills. But let's look at another prescription here. Yeah, I don't have one that shows a refill. So for example, if we look at this one again, if John Smith, whose birth date is January 1st, 1980, wants to fill his prescription for Colace, 100 milligram, he will go to the pharmacist, and she will tell, okay, your doctor allows you to get 30 tablets. You should take 1 tablet by mouth at the hour of sleep at bedtime, once a day at bedtime. But you only get 30 tablets, Vitaly. You can't come back for a refill. If the doctor writes 2 here, then what happens, Diana? If there was a 2 here instead of a 0 right here, what could you do then? What could John Smith do?
I would be able to dispense the same prescription 2 additional times. So they would actually get the medication 3 times total.
For a total of how many tablets?
For 90 tablets.
Yeah. Over what period of time? All in 1 week? Could he come in 3 times in a week and get 90? Or would you be obligated to wait a month between prescriptions?
He could get it all in 1 week. For patients here, if they have insurance, some insurance restricts the ability to refill prescriptions before the 30 days has passed.
So in the United States, unlike perhaps Ukraine, where I can write a prescription to Vadim and Vadim takes it to Dobrodnya pharmacy and he gets 1 30 tablet dispensation of medication, and then he walks across the street to Kopieka Atieka and he gets another 30 tablets, and then he walks over to another pharmacy and gets another 30 tablets. In the United States, the payment system by insurance companies often controls how soon you can refill. All right, let's move on. What I want to do now is look at the questions that you were kind enough to post on the internet. So let's open a time of dialogue. Khadija, I'm going to help explain your question in a little bit clearer English. The first part of it asks, in the beginning of COVID pandemic, we understood the cytokine storm. Okay, it's the
My English.
cytokine storm.
Rubbish, sorry.
Some doctors, some thought leaders were recommending paracetamol instead of ibuprofen, and some others thought ibuprofen would be better. There was some controversy about this. What was your view about this idea in United States? Diana, do you have any opinion about it?
I think initially with the pandemic, there was very little information. The French health minister did observe some patients that used NSAIDs to have more severe symptoms, but there was no causative connection. So I think initially the warning was to not use the medication ibuprofen with COVID, but with additional data at this point, there is no added risk because some patients would have had the same symptoms without it. So it's the initial stance, especially with the World Health Organization, was to not combine the two at the beginning of COVID, but now it is okay to use paracetamol or ibuprofen without worrying of causing additional harm to the patient.
And as a pharmacist, you would not see this because both of these are over-the-counter medications.
Correct.
So she would not be seeing doctors' prescription behavior about these. So I would say I prefer ibuprofen. Knowing what we know now, I'm not worried about the cytokine storm being damaged or negatively influenced. I think ibuprofen as an anti-inflammatory is exactly the right medicine to use, for example, in the COVID-induced autoimmune inflammatory response. The next question is about AstraZeneca. I'll speak to this. I think it's a good question because political influence, social media, pharmaceutical sabotage, and economic fighting can all be part of this incredible AstraZeneca response. We saw the British company lose market share. Their drug, their Covishield, I think it's called, was not popular because of the risk of blood clots. But the facts are that this is a good medication, and I think many people could benefit from this drug. I think it is basically as safe as the other Pfizer, Moderna, and other best leaders. You know, this is just my opinion as I've read the literature. But I also think that social media was the problem, especially because you know how it goes. Somebody voiced a death of a family member when they took AstraZeneca, or somebody got a blood clot, and all of a sudden the whole world knows about this. One case or two cases. But if it were not for Snapchat or Instagram or Facebook, that news would not spread so rapidly. Science was overpowered, I think, by social media.
Yeah, can I add some from my experience, because I had 7 years working in different farm companies.
Quickly,
in my
please.
opinion, I will pass it with you. It was economic fighting of company for the market.
I think you're speaking to an issue of trust, and I believe that probably the biggest reason that I came to Ukraine as a man of faith in God and a desire to help you as my colleagues from the Western thought is to help you see the importance of doing things that enable your patients to trust you, to trust your advice, to be honest and ethical about the way you give advice. I think that we do have pharmaceutical wars and thought leaders that are paid to give different opinions today. That's a very sad commentary on our society today. So let's be ethical doctors and let that be driven by our faith in God. Number two, Yvonne, you've got a great question here. Would you read this for us, please?
Yes. So, is it possible for a U.S. pharmacist to change the prescription that the doctor gave for a patient?
Good question.
Okay, the answer is it depends. In the position that I am in, I cannot change a prescription without consulting with the prescriber and getting consent to change a medication or change a prescription. There are specific clinical settings, like in a hospital, if a patient, if they are inpatient and there is a limited amount of drugs the hospital has on hand, say, for example, you prescribe omeprazole, which is a PPI, and the hospital only stocks pantoprazole. It's in the same class, so the pharmacist can automatically substitute it to what the hospital has available. But that is not as common with the majority of prescriptions.
I had pharmacists call me to clarify my bad handwriting on prescriptions. They could not read what I wrote, and so they wanted to just clarify.
Mm-hmm.
And then they would say things like, you know, Mrs. Smith can't afford what you've prescribed. Would it be okay if we give her a generic substitution, Dr. Crane? And I would say yes, or I would say no, depending upon that particular case. Now, Diana, what is a generic? And are you able to change from name brand to generic medications without doctor approval?
Well,
Let me pull up one of these images again.
yeah.
I don't know that we
So
have.
with generics, when a drug first comes out, it's the brand name and they carry a patent on it for a period of years. And once the patent expires, then other companies can manufacture that drug in producing generics. So the majority of the time, pharmacists can substitute a generic for a brand name if it exists. And there are occasions where the prescriber will designate on the prescription that that is not allowed. Most of the time I see this with patients taking medication for their thyroid. So they are locked into a brand name Synthroid instead of levothyroxine because they can't maintain the proper lab values on the generic.
All right, so if you can look at the top right corner of your screen here that I'm moving, a doctor here in Pittsburgh, Pennsylvania has a prescription that says product selection permitted versus dispense as written. So talk about these positions on the prescription for us, Diana, please. You may use the...
Yeah. So we say brand name and generic. On the prescriptions we receive, it will say product substance selection permitted. So that's another way of saying a generic is allowed because the prescriber signed the prescription in this lower left corner.
So this drug is Lipitor, and that's a brand name.
That's correct.
Right? Made by a particular pharmaceutical company. But because Dr. Schultes has allowed a substitution, what might you select to reduce cost for this patient?
We would dispense the atorvastatin for the patient.
Atorvastatin. What drug class does atorvastatin belong to?
Statin.
Statins.
They're statins. So there's a big fancy name for the statins. It's HMG CoA reductase inhibitors. That's the other name for statins. What do statins do?
Blocks the cholesterol synthesis?
No, he said dropping cholesterol of high density is up and low density is down, is opposite.
So it lowers LDL cholesterol and raises HDL. Excellent. It also seems to stabilize the endothelium. So here, this prescription says that a product selection is permitted, which means substitution to a generic is allowed. If Dr. John Schultes had signed his signature here, what would that mean, Diana?
That would mean I could only dispense the Lipitor. The patient would not get atorvastatin.
Any questions about that?
Not quite about that, but it's pretty related question. We had a lesson in internal medicine, and that was a submodule of rheumatology, and we were talking about this new brand, like cutting edge drugs, biologics, and I said something. Okay, so we have like adalimumab, and she said, "What other drugs can you name?" And I said, like, you know, there is Humira, like a brand name, and there are some other generics. And she stopped me and said, like, it's not proper use of this word in case of biologics. You can't say like that.
Can't
And
say Humira?
I didn't quite find anything about this on internet. So I would like to know.
Maybe
Thank
she's asking you to refer only to the generic names rather than Humira, which is a brand name.
Mhm.
What do you think, Diana?
I'm not sure on that one. All the biologics available in the United States are still brand name only. So and out of comfort for pronunciation, it's easier to say Humira instead of the long generic name.
I see. Thank you.
I think that's a great question. Now, one final question about this. Natalia Huzik, what does this mean right here?
Refills, it's mean how many times pharmacists can give this medicine to a person who would like to have this medicine. I think a person can have all medicines for 3 times.
That's right, total of 3 times. So this 30 plus 2 more 30s.
Two more, yes,
for
for
a
2 more.
total of 90 tablets. Excellent. Okay, great. Now let's finish our lesson with the final questions and then a little translation exercise. Tanya asked a question. In Ukraine, it's common to prescribe probiotics. Tell us about probiotics in America. Do you know what probiotics are?
I do know what they are, but it's a very broad term because the products available contain different strains. There are different combinations of those strains. It's all available over the counter, and it's considered a dietary supplement and not an actual drug. So it is not regulated by the FDA, and there's not clinical data to support using one over another.
How about clinical data? Were you trained in pharmacy school or even in your postgraduate continuing education as a pharmacist? Is it recommended that U.S. pharmacists promote probiotics when prescribing antibiotics? Is this an important thing for the gastrointestinal system?
I believe it's important for the gastrointestinal system. It is something that is not looked at and commonly recommended. It is something I do encourage to my patients, especially if they are on a very strong or a broad spectrum antibiotic. It does mess with the gut flora, and there's been more and more data coming out with the connection of gut health relating to other issues that a patient may have. So it's where 85% of your serotonin is produced. And I like serotonin very much, so I want to keep my gut as healthy as possible to have as much serotonin as possible for myself. So it's something I think practitioners like pharmacists need to look at more closely because of that connection with the gut, with other health systems.
Good question and excellent answer. Thank
Yeah.
you. Gut flora. What is gut flora? What does that mean? Gut flora.
Кишечная флора.
Микрофлора
Bacteria,
кишечника.
bacteria that live in gut.
Yeah,
Yeah.
the gastrointestinal combination of all the different types of bacteria that live inside the gastrointestinal tract. Good. It's useful for Diana to know that it's very popular to prescribe probiotics with antibiotics in pharmacies for Ukraine. The pharmacists and doctors almost always recommend it. And my feeling as an American doctor is that there's a little bit of pharmaceutical influence there. And I think the
No, yeah.
pharmaceuticals are making a lot of money on relatively unnecessary things. I think kefir or buttermilk
Yeah.
would probably work quite well.
Oh yeah, I mean, you can get probiotics from foods that it's not necessary to purchase a supplement. So kefir or yogurt, sauerkraut, kimchi, anything kind of fermented and pickled would be a sufficient source.
Because in Ukraine, the antibiotics may cost like 100 hryvnias and probiotics will be 500 hryvnias. So,
Oh,
So it's a great
yes,
money-making opportunity. So my colleagues, I would tell you, let science help you with driving your decisions and advocate for your patients, not for the pharmaceutical companies. I'm not against, I think Linex is a great product. I think the acidophilus and the bacterial content of that product is great. But I also think that in Ukraine, it's a great money-making opportunity for the pharmaceuticals, which is unnecessary. So as you protect your patients, protect them, please, with your heart.
And in pediatrician, they have a lot of cases when you should use the probiotic because we have there not just, it's about immune system also. And when you use antibiotic, you're killing, and we can't to replace just with the, they have lacto bacteria and have bifida and lactobacteria. For that, if you give just milk, it is, if not both put it there, bifida, it will be not replaced bifida bacteria, but will be lacto.
Bifida. Okay. Well, this is exactly what this opportunity that we're doing right now gives us, is a chance to listen to one another and learn together about best practices of evidence-based medicine. I'm going to post the chat information that Vadim Vuls just posted to everybody. Take a look at that. He's got a number needed to treat was 9 to prevent antibiotic-associated diarrhea. So that's good information. Finally, let's move on to Medicare and Medicaid. Yaroslav, are you with us?
Hello, everyone. I want to ask Diana, tell me please more about Medicare and Medicaid program. What opportunities have the categories of vulnerable patients due to this program? Is this program cover the medication treatment without payment for this patient? Thanks a lot.
okay.
Great
Okay.
question.
Yes, and so Medicare and Medicaid both exist to help vulnerable patients. Medicare is for patients that are 65 years and older. Medicaid is, it's based on income. So patients that are living at or below the poverty level can receive assistance. And so they categorize that into different levels. So depending on the income or the lack of income, there may be things available without payment whatsoever. Some patients do have to pay a small fee at my pharmacy for medications, but it is significantly less than what an average patient would pay.
Okay, let me just leave it as this. In a fee-for-service capitalistic society like America, I will say as a doctor, I think our system of healthcare in America is ridiculously complicated and is extraordinarily costly. I think we're spending 16 or 17% of our gross national product on healthcare in America. And I think that countries that are more socialized, I'm not advocating socialism, but I'm thinking of Switzerland, of Germany, or other systems that have global health care for their people, money is being better spent. Now, I will say that the Medicare and Medicaid programs, Yaroslav, help us take care of the vulnerable people. It's a government program that protects the weak and the elderly and the frail people of the country. So it works pretty well. And I think most of your older people are very thankful for Medicare payment for their medical needs, right? All right. So we're at 1 hour and 10 minutes. Let's do this, and then I'm going to open up for final discussion. I've got a translation exercise for you. Here is the familiar compendium. All of you know this in Ukraine, right? So I just put it here to remind you that this is the ATC classification. Here's a Bible verse that I think is very useful. Let's work with your English. Let's translate this together, please. Who wants to give it a try? I've chosen this particular proverb in the Bible because one of the English translations uses words that is very relevant to our lesson today. And I'm going to show you that in just a minute. But do your best to help translate this for me.
I broke my mind already.
It's mean веселое сердце благотворное, как врачи.
Joyful heart, maybe.
So the word heart is clearly here, right? What kind of heart?
Happy, maybe, not веселое.
Joyful.
Joyful
All right.
heart.
Happy or joyful heart. Now we need an adjective, and I mean an article, and I'm going to go ahead and put it in for you. Now, what about this happy or joyful heart?
Благотворно.
Ah, I like the Ukrainian better. Добре лікує.
Treats well.
Treats well. I think that really conveys the meaning. So there's some medicine right there. A joyful heart treats us. What does it mean to treat?
To resolve.
And with endorphins.
To resolve
I like
a problem.
that. Like endorphin. Okay. What's this A here?
But.
But, yeah.
Here's a contrast.
Broken spirit. But it will be no. No, it will be not. It will be not but because it is no. No, потому что. No, not.
Okay. So Khatice's giving us some nuances in the language. That's good. So what alternative do you recommend, Khatice, if not but?
So.
All right. So we'll put in the idea of so.
Because but it is no. It's not but.
But it can be Ukrainian. Doesn't this Ukrainian here
it's
contrast?
Yeah, it used as a contrast. So.
Yeah, so but would be better. Yes.
Yeah, it looks like.
Yes.
All right,
But
so
we expect it in
I'm gonna say so could work, but I think but is better. Keep going. Broken spirit. Somebody said.
But это
Dries
но
out.
оно не лечит.
Dried bones.
Dry bones.
Dries out
Dries out
the
bones.
bones.
That's good. All right, now, very good work. A happy or a joyful heart treats well. And I really like the idea of endorphins. I think that's a great insight as we have as doctors. But a broken spirit, interesting, a broken spirit. So many of us are broken because of bad things that have happened to us in life, unfortunate social circumstances, poverty, failing marriages, dying children, a war in the east of Ukraine that's taking young people. Those break our spirits, right? Look at this translation.
Cheerful heart is good medicine, but.
Vadim, please read that for us. Please read that.
A cheerful heart is good medicine, but a crushed spirit dries up the bones.
Yes. Now it's interesting to me that the bones are mentioned here. What's inside the bones that's very important?
Calcium and
Bone marrow.
phosphorus.
The bone marrow.
Костный
Calcium,
мозг.
phosphorus.
So why is the bone marrow important?
So as all these stem cells from there.
It produces
Produce blood cells.
And probably in the context of COVID and our current pandemic, what are the most important cells being produced from the bone marrow in today's context?
Red blood cells.
I would say red is important for oxygen delivery, yes, but I'm suggesting that the immune system comes out of the bone marrow. The white blood cells, the natural killer cells, the B and the T lymphocytes. When we have a crushed spirit, when we don't allow God to help us with our problems, when we don't go to Him in faith to let the spiritual part of us grow as people, the natural result is that we suffer medically. And I think it's the immune system that takes the damage. So I want you to think about a Bible verse like this. It's very important for us as doctors to integrate our faith.
Psychosomatic, yeah?
Okay, very good.
Psychosomatic. If you have stress, it could be cause of cancer very often. And cancer, it is one of circle of immune system broken, which is include T lymphocyte and another factors like cell killer of out cells which is atypical. Yeah,
We
all
can
immune.
psychosomatic medicine. We will all deal with psychosomatic medicine our entire careers. We will deal with people who have physical problems because of mental and spiritual stress and difficulties. I think
by the way, we must be optimistic.
Yes, I think, you know me, my glass is half full, not half empty.
Yeah.
Right? And I think we all choose to live life by our minds and by our spirits, how we choose to look at the world around us. Am I going to be
mostly in elderly patients?
Yes. And so I think we must advocate and protect those who are vulnerable, right? Do you have any more questions for Diana? This is a great privilege to have you with us. I want to thank you for today.
Thank you for having me.
Do you have any more questions for her while we have a few minutes? And then I'm going to ask her if she has a question for you. So be prepared. But first, you go first.
Thank you very much, Diana, for your lesson with Jeff. It was nice to meet you. And I guess that's the last question. So returning to the topic of refills. So it's common in Ukraine to have a babushka, it's like a grandma who saw a doctor like 20 or 30 years ago, and she got a prescription like you need to like take this antihypertensive medication. And it's pretty common that nowadays, like today, she goes to the pharmacy and she takes the same drug that was prescribed like 20 or 30 years ago. Is this possible in the US in context of those refills? Are they limited somehow? Is there any upper limit how many times a patient can get a refill?
Yes, there is a limitation in the United States for non-controlled substances. You can refill up to 1 year. So the prescription is valid for 12 months. But if she fills it now and she has 3 refills, but she does not refill it again until let's just say February of 2022, she would not be able to get all of her refills because it would expire before she would use all of the refills.
So it's a total of 1 year.
Yeah, it's valid for 1 year. But
it has no more than a year's usefulness, a prescription in America. So the babushka's prescription would not work in America more than a year.
Yeah.
Thank you.
And that really does protect our patients, right? It gives a need for review and revision of the doctor-patient decision. Vadim, you have a question?
Yes, Jeff and Diana, thank you for this lesson. And I have a question, maybe very silly. Do you use a same bottle to refill pills another time?
No, we use new ones every time.
Thank you.
America is the land of waste.
Yes.
We throw away way too much here. I am surprised again during my visit to America how much we're putting into the trash can that should be recycled or reused somehow. And that's a shame for us.
May I ask a question?
Sure.
Yes.
Thank you again for this lesson. And so continuing my question about changing the doctor's prescription, when you see something, so Diana, when you see, for example, that a physician or that is written in the prescription, for example, a contradictory medications like agonist and antagonist, what will be your actions in that way when you see something suspicious like that?
The first step is to explain to the patient that there will be a delay in getting the medication ready because I would like to consult with Dr. Crane because he wrote a prescription that seems contradictory.
Stupid prescription.
So just making the patient aware that I cannot fill it the way it's written. I would like to consult with their prescriber first, and just to make sure that the physician did not mean to do that. And if they did, I may have to explain how they do contradict with their mechanisms of action and how it may not be in the best interest for the patient.
So you will tell it directly to the physician?
Yes, yes. I would reach out to the physician. Sometimes I can get in touch with them. Sometimes I have to leave a message with the nurse.
And I'll say that as a doctor, particularly as a young doctor, many years ago, there were pharmacists who saved my rear end very well. They were very helpful in protecting me from mistakes and showing me that I had made maybe a bad decision. I might want to reconsider that prescription I wrote for Mrs. Smith because it doesn't make sense, you know. So I was very thankful for that communication with pharmacists. They know the chemicals and the pharmacology better than we do as doctors, right?
Thank you so much for your
Yeah,
answer.
right.
You're welcome.
Okay, Diana, do you have a question for our Ukrainian colleagues? What have you observed today that makes you have more questions about the way medicine is done in Ukraine?
Well, my question is the availability of the COVID vaccine over there, and what do you have available if you have the AstraZeneca or if there's some other kind, and how many of you are vaccinated?
I'm not in Ukraine.
So generally speaking, we have Pfizer vaccine as well, and AstraZeneca or Covishield, and Chinese vaccine. It is inactivated vaccine, as I remember. So it's CoronaVac or something like that.
Okay.
And also, it's going to be that one Novavax probably, but it is still not here for now. But it will be, as it looks for me. And so the medical workers can be vaccinated on the first line, especially those one who works with COVID. And after that, officially, the next step is to vaccinate the people who are older than 75 years, and after that, the 65 years. And so due to maybe like few weeks ago, a person might get vaccinated when they contact their like physician, GP, and there is, so basically there is an open bottle of AstraZeneca and you can give it 10 doses. And there is like one dose that, for example, a person didn't show up who would like to take a vaccine. And then a physician will call those who are on his personal list and say that you can come if you can, like maybe for an hour like not more than an hour after that call. But that system is now, as I know, officially is restricted. So basically, in Ukraine now, you can get vaccine only if you are more than 65 years old, and or a medical worker. And the next step is to vaccinate socially important workers, like education, probably, like teachers.
Yes.
And after that, it will be going to the people who are younger. But for my perspective, it will be really slow, because we have only probably for the last day we got like only 15,000 vaccines all across the Ukraine, and the vaccination rates are pretty much slow. That's why our healthcare minister was resigned yesterday. It is the official reason.
Okay.
Yeah.
Sorry, how many percentage of generation was vaccinated in Ukraine? Population, how many percentage population vaccinated
Already
in Ukraine?
vaccinated?
Not yes. How many percentage?
Like 2 maybe.
What?
Maybe less.
Maybe less.
2% with 1 dose, and less than 1% with 2 doses.
Heartbreaking.
Thank you for that information.
Yes, may I ask a question to Diana?
Yes.
Not COVID related.
Okay.
Diana, thank you for a great lesson. I would like to ask you a question about such a term as pharmacy claim. Recently, I faced with this term, and it was explained to me like pharmacy claim is a prescription covered by the insurance. Is it true? So basically, what is pharmacy claim?
It's very similar to like a bill or an invoice. So we provide a service to the patient, and then we submit a claim to the insurance company stating that we provided a service. So we are trying to collect payment for that service.
It is a document issued by pharmacy to the government, yes?
Well, so most of the time it is an electronic document, but it is a statement we send to the insurance plan to try to be compensated for a service that we have dispensed a medication to a patient.
In the same way, an automobile claim, if I wreck my automobile and I have insurance in the United States on that automobile, then I can put in a claim, or I can put forward a claim to be reimbursed or to have that automobile repaired. That is a claim. So it's about payment. It's about money transaction after an event.
Okay, thank you.
You're welcome.
She's a dentist.
Ah, okay.
And a good one.
Thank you, Jeff.
All right. Are there any other questions? This has been a great lesson. I appreciate the dialogue back and forth. Your English is getting better, colleagues. I am impressed.
Your Russian become very.
And
May I ask a question? May I request?
Sure.
I want to ask about also clinical trials. Are you as a pharmacist in some way involved in the clinical trials? And if you know, is there any doctors in USA involved in clinical trials in their health centers?
It is an opportunity for pharmacists to be involved in clinical trials along with medical providers. It's not something that I have ever been involved in, but they do include pharmacists and physicians in those studies.
I saw in England where I worked, there was trial with something thrombolytic in cardio. I saw in the paper of patient trial, this, I don't remember the name of this thrombolytic, and still in England it's happening also. And patient just with the patient agreement, not like in Ukraine.
So trials are large.
Ukraine patient even not be, in Ukraine, farm companies can do trial without, and doctor can do trial prescribe medication which is not approved by FDA or Europeans, and then the patient even don't know about this and buying, and it is selling without any proof, and at the same time going trial, and patient even don't aware about it. It's happening in Ukraine.
Oh,
And therefore, we need God's honesty and
In
ethics.
England, the patient know about it and they agree with it, and sometimes they have benefits. In Ukraine, some of them, yes, but most cases, patients even don't aware.
I hear about it for the first time that some doctor in Ukraine give to patient medicine what wasn't approved and without. It's something really new for me because I know a lot of doctors who work is medical trials, and they never ever told me something like that. That even it's that they even to think about to give the patient medical without без їхньої згоди.
Consent, patient consent.
Sometimes doctor, because all this institutionalized in the country, and sometimes doctor even self not aware about. Unfortunately.
Let's finish with this
Struggle.
thought. I want to encourage you once again, medicine is not a business.
Yes.
It's okay to make money and you should be reimbursed for your good work. But medicine is not a business. It is a God-given, honored profession. Just as the teacher and the professor of the university and the priest and the clergy and our pastors guide us, we are guiding many people in society as professionals. And I challenge each of us to be the best we can be. And the best that can be is with an understanding of a God who created us and faith to guide our lives to things that are better and higher. So let me leave you with that thought. I am praying for you as colleagues. I will be with you again in a week or so. Thank you for a great lesson. Have a great day. See you next time.
Thank you. It was great.
Thanks a lot. Thank you, Diana.
Thank you, Jeff.
Thank you very much.
Thank you, Diana.
Дякую, Jeff.
Дякую.
Thank you so much.
Thank you.
Будь ласка.